right, I'm going to go ahead and get started. I'm going to start by introducing myself. My name is Ina Bruce. I'm a board certified family nurse practitioner. I also have a master's in public health. I own Apex Men's Wellness, which by the names, it's a men's health clinic. Today, we're going to be talking about testosterone and heart health. And I want to take a moment to thank you all for joining, how we explore this topic of testosterone, how it impacts heart health, and why it matters to every man. And if you haven't subscribed or liked yet, please follow us on Instagram, Facebook, TikTok. I have to add LinkedIn. I also have a LinkedIn and I have a YouTube channel. I will release that very soon for you guys as well. All right. So why this matters? Why discuss testosterone and heart health? It's because heart health is the leading threat to men's health. Testosterone is not just about affecting libido or muscle. It can literally influence your heart, metabolism, and longevity. So essentially, low T has an unfavorable effect on cardiovascular health. It's even considered a risk factor for cardiac disease. Why? Because low T often comes with, what do you call it? Poor metabolism, increased body fat, insulin resistance, higher cholesterol, inflammation, and also poor circulation and endothelial dysfunction. So heart disease is the number one cause of death in men. 1 in 3 men from 40 to 80 have low T. Naturally, so it's very common, but the issue is after the age of 30, levels start to naturally decline by 1 to 2% per year. But some men can see that a lot earlier or very drastic decline due to lifestyle or health choices. So the impact on longevity is basically when someone is telling you just, oh, I'm feeling off. Testosterone is just not about feeling off. So studies published online on May 14th of 2014 by the Annals of Internal Medicine showed that analysis of 24,000 men actually found that those with the lowest T had significantly more heart attacks, strokes, and cardiac deaths. And another thing I wanted to mention is the heart function link. So basically, testosterone helps blood vessel and blood flow. For example, low T is associated with ED. So often an early sign of the blocked arteries and heart disease is actually ED. So in fact, ED in men over 40 can basically signal that there's an underlying cardiovascular issue. So the bottom line is healthy testosterone is part of a healthy heart. Low T will contribute to weight gain, diabetes, high cholesterol, and high blood pressure. It's kind of a vicious cycle impacting your heart. So addressing low T when it's present can improve energy, fitness, and potentially your heart's health. And I'm going to move on to research, which I think it's really important I couldn't have given this webinar without addressing research, because the past concerns with testosterone, essentially about 10 years ago, some studies hinted that testosterone therapy might cause increased heart attack or stroke risk. The problem with this was that these studies were very small and they were flawed. So they're often in retrospective and in sick patients. So in 2015, the FDA reacted by adding warnings about possible increased cardiovascular risks with testosterone. So obviously you can imagine this worried men and doctors alike. So what we now know is that that's not true at all. We have robust new research that has clarified the picture. A large 5-year clinical trial with over 5,200 men published in 2023 found that TRT did not increase heart attack or stroke risks compared to placebo. So that's huge news. It's huge because the best evidence shows that testosterone therapy is not linked whatsoever to higher rates of cardiovascular events in men who need it. So this is as recent as last week, the FDA has actually removed the heart attack and stroke warning from the TRT labels. So this was basically the biggest thing. So in 2023, after reviewing the data, including the Traverse trial, they removed that attack and the TRT heart-linked attack and stroke warning. And let's see. So once and for all, that's settled that TRT is not linked to increased cardiovascular risk, sorry. So the thing is, they still caution that TRT is approved for hypogonadism, which is basically low T, not just common age-related decline, but the scare of major heart risk has been lifted and in light of the better evidence. So the ongoing consideration is that TRT appears cardio safe when properly used, but it's not a free pass to ignore health. So for instance, if you are someone who already has a heart disease, you want to make sure that you're being properly monitored by your providers. And if you have a cardiologist, then you want to make sure that we're collaborating with each other. Another thing is if you have maybe the same study that cleared heart risk, so notice that there was a slight uptake in arrhythmia. So in men on TRT, meaning that if you have AFib, atrial fibrillation, or other heart rhythm disease, you want to make sure that your provider is monitoring that closely. So other findings and observational studies show that lower rates of heart attack and deaths and those that actually untreated. So that's kind of interesting that they saw that. So basically that suggests that fixing low T in the right patient might actually improve health outcomes. So likely by improving the risk factors that fat mass, insulin sensitivity, and cholesterol. The biggest takeaway from this is that you don't let outdated fears drive decisions. Modern evidence-based medicine shows that TRT, when indicated and monitored properly, is highly unlikely to hurt your heart. And it may actually help you live better. So we're still going to follow precautions. We're going to monitor blood pressure, the blood counts, etc. But testosterone heart scare largely been debunked by solid science. That is basically the main takeaway. So now we're going to discuss some natural ways to optimize testosterone. So our approach is to blend at Apex is to blend functional medicine with the latest clinical evidence, obviously. So the biggest thing with this is functional medicine and integrative medicine is you want to fix the foundation first. So lifestyle first. Before you write a prescription, we want to ask, why is testosterone low? Often the root causes can include poor diet, excess weight, lack of exercise, chronic stress, inadequate sleep, or conditions like diabetes and sleep apnea. Those would crush your testosterone levels. So addressing these can significantly raise your T and improve heart health. Another thing is healthy fats and balanced diet. So nutrition, you got to eat for hormone health. There are plenty of protein. You have to eat healthy fats, for example, omega-3s and colorful veggies. Micronutrients matter. They just do. Low vitamin D and zinc can contribute to low T. So you want to ensure that those are some of the supplements that you are taking or getting enough from your diet that you're ingesting. So you want to also limit your excess sugar and processed foods because that can drive belly fat and therefore lower your T. Exercise. That is basically one of the best testosterone boosters. I tell all my guys, testosterone, like every other medication, is a tool. It's a tool. You have to do your part still. So I highly encourage them to do strength training. In fact, if you tell me you're not going to exercise, I'm just going to tell you that you shouldn't be on testosterone because it's not really, you're not going to reap the benefits and get the optimum effects from it. So strength training like lifting weights and high intensity interval training can signal the body to produce more testosterone. So exercise also increases circulation and cardiac fitness. So a win-win for your heart and your hormones. Then sleep and stress. That's one of the most underrated elements. People these days, it's all a run, run, run. We are not getting enough sleep. We are not managing our stress right. Testosterone is mainly produced at night. So poor sleep or sleep apnea can essentially tank your levels. You want to aim for about 7 to 8 hours of quality sleep. You want to manage stress. High levels of high cortisol from chronic stress can suppress testosterone. This has been shown countless of times in many, many studies. So integrative approaches like mindfulness, meditation, yoga, those can help balance your hormones. Now, the other thing is you also want to address any underlying medical conditions. For example, if you have obesity or metabolic syndrome, weight loss can naturally raise testosterone. Because fat tissue converts testosterone into estrogen. So if you have less fat, you have more T, okay? If you have type 2 diabetes, improving blood sugar levels, controlling your sugar is going to help. You want to optimize your thyroid also. You want to also optimize your thyroid to even see better results with the testosterone optimization. Evidence-based supplements. This is one thing that it's really important to address because there's a pill for everything, there's a supplement for everything. People just want to get all kinds of supplements anywhere, anyhow, but we have to be careful with where we're getting our supplements. Some supplements can support health T levels safely. For instance, vitamin D. If you are low, zinc, magnesium, and omega-3 fish oils are good for overall health. Certain herbs like ashwagandha and fenugreek have some research suggesting that modest T benefits that can be considered with professional guidance, of course. But definitely avoid the gimmicky ones that aren't proven. Stick to no nutrients and herbs of an integrated plan. So when is TRT appropriate? You want to start TRT when it's clinically indicated. For instance, if you are showing signs of low testosterone, you're having a hard time losing weight, you're having a decrease in libido and sex drive, you're having a hard time putting muscle mass, you're having a hard time sleeping, all that. So I don't treat just a number. You have to look at the patient in the whole picture. What does the level show? And what are your symptoms? And in our practice, we use bioidentical hormone replacement. So I particularly use injections and creams, but I don't offer pellets. We will basically meet, talk, and decide which is the best treatment option for you. Some safe TRT practices. Like I said, our holistic approach means that TRT is not a standalone fix. So it's part of a bigger plan. And we are going to use the lowest effective dose possible to get into a healthy range. We're not trying to get Superman levels. We monitor labs regularly, check testosterone, blood counts, so hematocrit, liver function, PSA, and all that. We also keep an eye on your blood pressure and cholesterol. So this proactive approach ensures that you're being monitored properly and that we catch anything early if there's anything that creeps up. Integrative hormone therapy. What I mean by this is because we are seeing it a lot more. We are seeing a lot more the decline in younger and younger men, which is really sad. But it's the environment, it's our food, but we are seeing that more. So in some younger guys, we aim to preserve fertility and natural function whenever it's needed. So there are options that we can discuss regarding that. HCG, which stimulates the body's own testosterone production instead of just shutting it completely down. And then that way we can tailor the strategy to each man's life stage and goals, essentially. So it's truly a personalized approach for all men. When is TRT needed? We spoke about that already. Bottom line is we want to optimize testosterone, and that is about optimizing overall health. We're going to combine natural methods with medical therapy to get you feeling the best possible while minimizing the risk as well. It's not an either or. So you want to get the best results, and it's going to be from blending lifestyle upgrades with safe monitored TRT if needed. Now I'm going to talk to you guys about some myths and some facts. So myth, TRT increases heart risk. So I don't, not to beat a dead horse, but like I said, I discussed a few studies with you guys, and this is just a decades old fear that has been overturned. The study has found and shown no increase in cardiovascular risk, and actually showed that men that have low T, if it's properly treated, then they actually have better cardiac outcomes than the ones that who stay untreated. The other common myth that we hear a lot is low T is just normal aging, so you should just accept it. So the fact is that while it is true that Testosterone declines with age. Healthy aging doesn't mean you have to suffer. You don't have to be depressed. You don't have so many people in anxiety medication, depression medication, all kinds of things, when really all they needed was someone to assess the full picture, check their blood work, check their T level, and voila, there's the answer. So treating clinically low T can restore vitality, mood, sexual health, and even longevity. So you don't have to just live with it. There are safe ways to improve it, and evidence shows that it can improve health-related quality of life. The other myth is natural boosters or over-the-counter supplements can completely replace TRT. We hear that all the time. It's just not true. Yes, lifestyle changes are powerful, and we want always use. I will always emphasize that with my patients. But if you have significantly low T, diet and supplements will not fully normalize the levels. They just simply won't, and it's just best to understand that. If someone wants to try that, I will highly encourage them to try it and then come back if that's how they feel. But I tell them straight off the gate that severe hypogonadism, which is another word for low T, often requires medical therapy to get the testosterone back to optimal range. If your T, say, is 200 nanograms per deciliter, that is very low for a man. That is very low, and you're likely to need TRT to just reach normal levels. And normal, again, I shouldn't even say normal, optimal level, because normal is not optimal. What's optimal for one man is not going to be optimal for another man. So that said, taking supplements like vitamin D or zinc can be of great support. In fact, all my guys, I put them in vitamin D and zinc, just not one-to-one replacement for prescription. They're just not for replacement. So in TRT, in truly deficient men. And then another myth is that TRT is basically taking steroids, which is dangerous and is only for bodybuilders. That's not true. Again, TRT restores normal levels, unlike steroid abuse. Steroid abuse is dangerous and will most likely harm the heart. But TRT for health is not the same as steroid abuse. In TRT, we just replace what's missing, aiming for physiological levels, not, like I said, not Superman levels. It's without pushing levels into risky territory. So you're monitored by a medical professional. You should always be. Testosterone is a controlled substance. Though it shouldn't be, but it is. You should always be monitored by a professional if you choose to do testosterone replacement. And then the other myth that we hear all the time is that testosterone therapy will give you prostate cancer or make your prostate enlarge. TRT does not cause prostate cancer. Evidence does not support this at all. Men do need to have periodic checks of their PSA and prostate exam starting at a certain age, 40 usually. But of course, if someone already has prostate cancer, we want to approach TRT carefully. You want to talk to their urologist, come up with a plan, because I've had a patient actually who the urologist cleared him. The urologist believed that it would actually improve his health. So we have no issues getting him started. But for the average man with low T, when monitored, it's really highly unlikely to create any issues with the prostate when it's, again, studies have showed it's with prudent monitoring. And just to reiterate safety, the myth is that TRT is completely risk-free. Nothing in medicine is 100% risk-free. That is why it's important to have a professional monitoring. That is simply crucial. While we've shown major risks like heart attacks are not increased, TRT can have their side effects: increased red blood cell count, acne, oil skin, mild fluid retention, or increased blood pressure in some. So again, that's why professional monitoring a plan is crucial. These side effects can be easily mitigated, easily manageable. For instance, adjusting dose. If your blood count is high, we can adjust the dose, we can adjust the frequency, and so on. Now we're gonna move on to the Q&A. One thing that I forgot to mention at the beginning, for those of you who stayed until the end, I will have a little gift of you. I will mention it shortly, but just to go ahead and ask some of the questions. So I got some questions here earlier, so I'm gonna go through them and we can talk some more and see. Is testosterone therapy actually safe for someone with heart disease or high blood pressure? Again, yes, studies show that there's no increased heart attacks or strokes with TRT. If you have a heart issues, we are going to manage it with your cardiologist if needed. If many men will well manage heart conditions, tolerate TRT just fine, and see improvements in energy and exercise capacity, all of that. Now, let's see. And the question is, can I boost my testosterone naturally without meds? Again, often yes, but specifically the levels that you're going to be getting with actual TRT, no, that's just reality. You can lose excess weight, you can get good checks for something, you can check for vitamin D, you can check for your thyroid issues, and you can fix those, but some men simply will need a TRT no matter what to get the optimized levels. And then what side effects does TRT have and how do you manage them? We talked a little bit about that already. Generally, the common ones are oily skin or acne, usually temporary. Increase in red blood cell. Again, I said we could change the frequency, the dosage, and all of that. Let's see what else. And then for blood pressure, we check it and ensure that it stays in range. So often improving lifestyle, whatever you're eating, again, nutrition, hydration, working out, all of that. For fertility, we can add HCG to keep the testicles active. So most side effects are reversible or controllable. We will discuss this with you more one-on-one to go over and make sure there's no surprises. Again, if another one, if the CRT affect the fertility, I'm young and I might want kids in the future. Great question. Yes, CRT, exogenous CRT, exogenous just mean that it's coming from the outside. It can suppress sperm production while you're on it. Essentially, it can act like male birth control. This effect is usually reversible after stopping. So it may take several months, but it is reversible. So instead of straight testosterone for these younger guys, we might use medications like HCG that boost your own testosterone production, and that helps preserve fertility. So if you're on TRT, we can add HCG to maintain some sperm production. I also, if you're young, I'm gonna strongly encourage some sperm banking, and I'll give more information about that. So you don't have to choose between testosterone health and fertility. We can most definitely often achieve both. I don't see any other questions here. So, but feel free to shoot me emails if you have any other concerns or questions, or I'm definitely here to address all your concerns. One last thing, as promised, for those of you who stayed till the end, I want to make sure that we are officially accepting clients. So for a limited time, I will have a founding member rates available. Just make sure you go to apexwellness.com, go to contact us and put in our request of information, and make sure you put the code FM15 so I know that you were on this call and give you credit for it. Again, the key takeaways here are that testosterone, heart and heart health are connected. If you're experiencing low T symptoms, low libido, fatigue, eating, mood changes, it's not just vanity. It simply isn't. And it can affect your heart health. And it's been proven by studies that this is the case, and your long-term health. So the good news is, through a balanced approach of lifestyle and evidence-based medicine, you can boost your testosterone, improve your risk factors, and feel years younger. Holistic care is powerful. We emphasize treating the whole person: nutrition, exercise, stress, sleep, and hormones together. This comprehensive strategy yields the best results. Simply put, it just is what it is. Testosterone is not a standalone. It's not a miracle tool. You still have to do your part for optimum results. So this is the part where I ask you to not wait to act. Your health is your biggest asset. You could have all the money in the world, but if you can't enjoy it, you can't be there for your children, for your grandchildren. So this is the time for you to think about your health and your cardiac health in this case, and overall health. So reach out to us. We can craft a personalized plan for you and take it from there. Again, thank you for coming on and spending the night with me, for engaging and asking questions, and do not hesitate to reach out anytime. Before I go, I do want to mention that I will have another webinar in about 2 weeks, and this one I will actually focus on nutrition. We'll do a deep dive into nutrition and all it entails, nutrition and testosterone in the male. All right, guys. Again, thank you so much. I really appreciate you spending the night with me. Take care and call us, book a consultation today.